So I think that telehealth definitely has a role, and it's coming. I mean, that's just the reality, just look at AI and all of that. And so, it's kind of my take and Alex's take on telehealth and kind of the impact it has and whether you embrace it or not is coming.
Yeah.
But I think Congress and everybody, I think, is still trying to figure out, well, how do we actually make it work?
If you can go to the doctor, just go to the doctor. You get a better evaluation. To me, that's the best way.
Right. Because you really can't have the patient take his own blood pressure or her own blood pressure if they don't. We assume everybody knows how to take a blood pressure,
Yeah.
but that's just not the case. And then now you're talking about listening to their lungs and all that. I just don't know how the primary care doctors make it work.
Let it's priceless, take it to the moon. Priceless, one day will be soon. Like it's priceless.
Hey everyone, welcome to another episode of D-Talk with Dr. Pham and my new co-host, Alex, otherwise known as Penis Queen. So, once again, thank you for joining us. And I just need to make this disclaimer. Everything we talk about on this show is purely my opinion and Alex's opinion. This is just as a public service to kind of educate the public on just various healthcare topics that you may find useful or not. But whatever it is, if you think you have it, get it checked out by your doctor. And then if a specialist is needed, then they'll refer you there. Now, the topics we talk about will tend to revolve a little bit around urology, just because that's what I do for a living. But we're going to talk about everything and anything in between. So I think we're going to have some good content today. But today we're going to talk about basically televisits and kind of like a doctor point of view. And then Alex has done it before, so she will talk about it like from a patient point of view.
Yeah.
Yeah, and then obviously subscribe so that we know people are enjoying this, and it'll help us continue to do this, as a public service to really just educate the patients. It doesn't matter if you live in Wisconsin, New York, California. The whole goal is you have enough information where you have the right questions to ask your doctor. And we purposely don't go in too much details about treatment and stuff because we do not want you to self-treat. You really, we only go out into enough details so that you have the right questions to ask your physician. Okay. And then obviously we mix it up sometimes with humorous episodes and all that. So we'll have some of that too. Anything you want to say, Alex, before we get into this?
No, just everything is pretty much our opinion. And from there, just go seek a professional, like your doctor.
Right. Okay. Well, so, ever since COVID, telehealth has kind of, telehealth has always been kind of on the horizon, but I think COVID really set in motion kind of a more concretized way of seeing patients with, without, because COVID was so new, I think we really didn't know how to handle it. And so it was always like 6 feet apart and stuff, which, I think the government has already said there's really, the 6 feet really wasn't really data.
Yeah, there's something they just came up with.
Pretty much. Which, remember you and I were asking the same question, like, where did you get the 6 feet from?
Yeah.
Because we never knew. But I think, the government pretty much said, like, they just kind of came up with something, to help. But, I don't blame them. I mean, it's a new disease. Nobody knows what you do with it, just like monkeypox, But I think you would agree that with COVID, I think telehealth started to really take off traction.
Yeah, it seemed like because people couldn't go anywhere or because they were really sick, they started doing telehealth. And mostly I feel like it's because they didn't want whatever they had to spread,
Right.
you know,
And
especially
so,
like being in lockdown.
right. And so I'm going to give my take on telehealth as a provider. And like I said, Alex will give her take on, a patient and the kind of the pros and cons that I feel and the pros and cons that Alex kind of feel. But for me, as a surgeon, it was a little bit hard for me to adapt because I've always known, especially in a surgical field, I kind of have to examine, the patient.
Yeah, like physically.
Yeah, like physically. And there's a lot of stuff that you get from the patient by sitting there and talking to them, looking into their eyes. 'Cause
Yeah, like nonverbal expressions.
Right. That's nonverbal expressions. And I think that gets lost in telehealth. And so that's one of the major reason why I don't like telehealth is because I know the resolution and stuff is good, but you're talking about going from a 2D where the patient is actually doing the physical exam. And so, let's say they have a nodule, it's kind of like, it's one of those things where the patient can feel it and they're like, yeah, I have a nodule, but they're not trained in feeling a nodule. Like, is the nodule soft? Is it?
Correct. If it's a little hard.
Right.
So kind of like if it simulates a cyst or a mass, like they don't know.
Right. And so, but like I said, that's from a surgical standpoint. Now there are a lot of non-surgical standpoint where I think telehealth, is beneficial. And so one would be, I think, if you live in a rural area where there's just not a lot of specialists, I think that is an area of, where telehealth really can be beneficial.
Yeah.
But still, at least I think the first visit still need to be in person, especially if it's going to be a surgical issue.
Yes, I agree. Because also, like, if the patient, are you trying to feel like the testicle, like if it's in the inguinal area, like you can bring it down and just feel it, versus the patient, they're not going to know like where it's at or where to feel, how to like, pull it down if they can.
Exactly. Yeah. So I think a perfect example would be retractile testicle, where all males have a cremasteric muscle kind of in this kind of inguinal area, like kind of where your bikini line area is. And, pediatricians and other doctors already have a hard time trying to palpate the testicle, let alone now you're asking the patient, hey, can you, you know what I mean? Like, can you try to feel it? I mean, it takes years of experience, like for you, it would be easy because you operate all the time with me, so but so that's one of the drawback is I think at least for surgical issues that require, that require palpation and all that. Now, maybe for kidney cancer, where really it's based on imaging and stuff, then, I think there may be a role for telehealth in that from a urologic standpoint, where really the surgeries can be based on kind of the findings and, maybe you don't need to physically see their eyes and all that because it's a cancer that just needs to be taken out.
Yeah.
Yeah. And so overall, I think for me, I'm okay with telehealth for certain things like maybe bedwetting or medication maintenance or
Patients
stuff like that.
Like they're out of town.
Yeah, patients that are out of town. But it just gets tricky because we're licensed to practice in Texas, but if we can't do telehealth if the patient is in, let's say, Florida. And so that's where it gets really muddy. So then, telehealth will be very beneficial there if, let's say, there's a good specialist that patient really want to see. But then now they literally have to fly over.
Yeah.
Yeah, because I don't have a license to practice in Florida or whatever state.
Yeah.
You know what I mean?
We also have like patients that come like drive like 2 hours or so,
Yeah.
like from another city, and that also helps them.
Yeah.
Helps.
So I'm not totally against telehealth, but that's just kind of from a provider standpoint where I think there is definitely a role for telehealth in order to get, kind of good access to care, but not having to travel hours and hours because there's a lot of rural America that you're not going to have. Like we're fortunate to live in Houston where there's just specialists everywhere, but I think in a lot of rural area you're just not going to have that kind of expertise.
Yeah. Was it hard for you to get used to it?
It was difficult because it was just weird at first because like if I told you you'd think I was joking, but like I literally wanted to grab at the screen to like examine, you know what I mean? And then I have to like, because it was so foreign to me because I've never done telehealth until COVID happened. Yeah, and it was just so foreign that when the patients would do the exam, like literally I almost like grabbed at the screen because it now I'm kind of used to it, but I limit telehealth to only certain situations because regardless, there's something about just having the patient physically there. And you can, because a lot of times you've seen this where they came in for one thing, but really they have another issue going on that's even more major. And I see that all the time where they're coming in because they don't even know what they have. So they just schedule it as a circumcision. And then when they come in, then that's when they're like, oh, yeah, we came here because the circumcision couldn't be done in the hospital because of, the penis was abnormal or whatever it may be. And,
it looked too small.
Yeah, it looks too small or it's twisted. And a lot of people don't even know, like a lot of physicians don't even know the names of these disorders.
Yeah, like the correct terms.
The correct term.
A lot of patients will come and say the line is a wandering raphe.
Right.
Like the line is not straight.
Right. And for those who don't know what a wandering raphe or the median raphe, what Alex is referring to is in male anatomy where the scrotum and the penis skin, attach, there's a line that goes kind of all the way from the bottom of the scrotum all the way to the tip of the penile foreskin. And that line is called the median raphe. And so when it's twisted, that's called torsion of the penis. But a lot of physicians, because, we're so specialized now in medicine where we're even like, I would probably say I'm more like a sub-specialist because I deal mainly with kind of genital reconstruction. And people don't know that, that's what it's called, penile torsion. So they just call it a wandering raphe, like it's moving away from the midline. Yeah. And so that's a perfect example. And then what Alex referring to small penis is usually because it's not the penis is small, it's just buried. Yeah. But then a lot of people don't know.
They don't know. They just think it doesn't look right. It's small. So then they come for a circumcision, but then it's like you have all this other issues.
Right.
Yeah.
And I think with telehealth, some of these median raphe, I'm just going to use that as an example. It can be difficult to see in the resolution that you need. Like I remember reading an article once, like on what, we talk about 4K and 8K and all that. I can't remember, but there was an article I read about the cones and rods in our eyes was like, the resolution was insane. And it's in 3D. So you can see how you can easily miss a penile torsion on imaging, and then you're like, oh, okay, yeah, you just need circumcision. Then you schedule them to come down. get an office circumcision. Then when they come, then you're like, oh, I didn't see this on the
Yeah.
telehealth.
Mm-hmm.
And so that's kind of my pros and cons about it. My partners, they kind of don't like telehealth either, for the same reason.
Mm-hmm.
I think there's something about just building a patient doctor relationship, and doing that through, the EMR. It doesn't give you that same feeling as you sitting there talking to the patient.
Yeah.
And so that's why at Crescent Urology, we kind of made it kind of an unwritten rule where we don't really type notes and stuff when we're talking to the patients.
Mm-hmm.
Yeah, like those, you need to focus on the patient.
Yeah,
because
so you give them your undivided attention.
Exactly. And you will get a lot more information that you may think you don't need and you actually need.
Mm-hmm.
And I think, and you'll talk about your experience here in a little bit, but I just think like now it's like we're all turning into like revolving door doctors, where like everything's based on imaging and this and that, and like nobody talks to patients anymore, and you actually miss a lot of diagnosis, or you could have came to that diagnosis easily without having to do expensive tests and all that if you would just listen to them.
Yeah.
But I'm going to turn it over to you, Alex. So tell me what you think as a patient who's doing telehealth.
So to me, as a patient, it is convenient because I don't have to go anywhere. I just stay at home, or even if I'm at work, I'll step out and do the telehealth really quick. So the other thing that I feel is like you don't really get, like you said, that one-on-one patient-doctor relationship, because I feel like when I start on the phone, it's like 5-10 minutes and then I'm done. There's just the simple questions and I answer them and that's it. So to me, I think it's better in person, just because you get more information out, just like you said.
Do you feel rushed like when you're doing these telehealth?
A little bit, yeah. I feel like I get on and they'll ask the basic questions and that's it. Like there's nothing else. So there's, like you said, I don't feel like there's that bonding, that communication with it. So it is good in a sense, but at the same time, I'd rather go in person.
Right.
Even though, like, if I go see, like, my PCP, I don't like going into the waiting area because people are coughing and they're sick. But, I mean, I think that would be one of the reasons why it's good, especially for, the elderly. They don't have, like, a car or have a hard time for transportation, or they're more prone to get sick. So I guess I see the benefits, but at the same time, I personally rather go in person as well.
Right. No, I totally agree with you. I didn't even think about that. You make a very valid point about kind of older patients, transportation issues,
Yeah, the other thing too is them trying to do the telehealth. They also might have a hard time just because it's all technology. It's new technology. Like we had a patient that called and we were going to send them the information to get labs, and he didn't have an email. He didn't know what an email was.
That's a valid point. I didn't even think about that.
And he was an older gentleman, and he said, what's a email?"
Wow. Yeah. You're totally right, because I didn't even think about that.
Yeah.
You have to be able to log on.
Yeah.
to
So
see
like
the
to
patient,
us, it's very like, oh yeah, here's my email. Oh yeah, let me log in. Like I know my password. Like what? And they're gonna be like, what's a password? What, I have to make one?
Right.
So there's a lot of like pros and cons with it. Also, like my therapist, she doesn't like to see me in telehealth, just because I do act different. I do, like, I don't know like about you, but when you're on the phone, you just pretend everything's good. When you're talking like to your family or the kids, or everything seems like it's fine. But in person, you can see the physical nonverbal expressions by the way you sit, if you're crossing your arms, if you don't look that interested, in the conversation or whatever is happening. That's a big deal too. That plays a big role, I think.
Oh, I totally agree with that. That's that. So I totally agree. I mean, like, there's a lot of body language that you can get that you may miss on telehealth, and so I definitely think there is a role for telehealth. Like, I don't think it's going away, but kind of what that role is going to be, how all these documentation is going to work. I think that's still being figured out.
Yeah.
But you are right. Like, urology, for me, my patient population tend to be children or, younger adults, yeah. But for my partners, urology is really a older patient field, guys with prostate issues, women with prolapse, recurrent urinary tract infection. I mean, you name it, yeah. And you're right. I didn't even think about that, but you have to at least be a little bit tech savvy on how to even log on.
Yeah.
And if you can't even get that, then, telehealth is just not going to work.
Yeah. Especially also if you don't have an email. So that patient ended up asking his daughter, and she was like, yeah, use this email. And he asked us, does a Gmail work? Is that an email? And so you can tell like they know nothing about the technology.
Right.
And thank God, his daughter was there, but like how do we explain, go here and make an email, know?
I mean, you can't. I don't know. Yeah. I don't know if you can,
Yeah, it'll be very difficult. And what if they don't have a computer,
Exactly. And now, you can do it on your phone and all that, but same difference. Like, if you can't even do it on the computer, how you can be able to do it on the phone? And, and then they sell these phones kind of more for older patients, which a lot of them are really, they're moving back to like kind of physical buttons.
Yeah.
And
the physical buttons and the flip phone.
Yeah, and the flip phone. Yeah. And so I, like I said, I'm not against it. And I think Alex brought up a lot of good, valid points that I didn't even think about, about transportation, about, are they going to even be able to log into it and all that. And so I think, my final thoughts on telehealth is I think there's definitely a role for it, but we need to get around the issue of, well, let's just say maintenance of medicine, but they don't live in the state. Well, how's that going to work? If they don't want another physician, they want you. And so is it like, do they have to travel across state line every single time? Like, let's say a patient from Louisiana, do they physically need to travel across state line at one of the rest station to make it,
to make a phone call?
To log on and then to make it legal. Yeah, and I think that's something that really needs to be worked out, because right now every state has their own medical board and all that. And so it's like, you live in a rural area that's, let's just say, on the border of Louisiana and Texas. And, it'll take, let's say, 3 hours to get to Baton Rouge or something. And then, but it only takes an hour and a half to cross state line to Texas. But it's just for maintenance of medication or whatever. And it's like they have to make that drive just across state line. Like, it's sometimes like common sense, I think, just gets thrown out the door. So, but I hope in the future they're going to have something where the lawyers, the same thing, you know, where certain states all agree that, okay, we take a unified bar, and so that you can literally practice in multiple
Both, yeah.
states. Yeah. And
No, but I never thought about that in that perspective, because I'll see like on Instagram or TikTok, doctors putting their videos, and in the comments it'll say, "Do you do telehealth?" And they'll say yes. And so I never thought about that, you know, practicing in your own state.
yeah.
Yeah.
I mean, I guess one way around it would be, and I don't even know because I've never tried it, but would be to try to get licensed in all 50
In
states.
multiple
Yeah,
states,
which
yeah.
is like that. It's just realistically, that's probably not going
Yeah.
to happen, you know.
Yeah.
But I hope we move towards kind of
Some sort of like agreement or law.
yeah, and then I think, you know, so I think that telehealth definitely has a role, and it's coming. I mean, that's just the reality, you know. Just look at AI and all of that, and so that's kind of you know, it's kind of my take and Alex's take kind of on telehealth and kind of the impact it has, and kind of like, you know, whether you embrace it or not is coming.
Yeah.
But I think Congress and everybody, I think, is still trying to figure out, well, how do we actually make it work? So, you know, the technology is advancing quicker than the law,
Yeah.
you know? Yeah. And I'll leave with this about technology advancing quicker than the law. This doesn't have to do with medicine, but I don't know if you read recently, there was a school district, I think in California, where somebody, they don't know who yet, I just read this a few days ago, where they did I think it was Beverly Hills district, where they took the students' faces and they AI generated nude pictures of that student
With their face.
with their face, but obviously not their body. Yeah. And so there's actually no law that says that's illegal.
Oh, wow.
Yeah.
No, I didn't hear about that.
Yeah, it's crazy. And that's just, you know, like literally there's no state or federal law that prohibits generating an AI image,
Oh,
because
my
it's not a
gosh.
physical image
Yeah.
that you took, because the law applies to physical image. Yeah, and it's just crazy. Yeah, because that's what they were discussing. Like, you know, like we all know, like, ethically you're not supposed to do that,
Yeah.
but the laws aren't catching up to
Oh my gosh.
to
I would
the
be
AI.
so upset if I found out my son, they did that with my son.
Oh yeah, so when I read that article, they were trying to figure out, you know, who generated this. Yeah. And it was crazy because I have an Android phone and Apple, but I think Microsoft, is it Gemini? Yeah, like it automatically installed it, and it literally, one of them literally said, you know, click here to generate AI images. And I was like, whoa, like that's just, it's like so bizarre to me. Yeah. And so,
Yeah, because they have websites so you can go in there and just type in, you know, landscape images, and the AI, like, and you can put, I want a big lake and like 2 trees, and it'll generate that picture for you.
yeah, wow. I mean, that's just, it's crazy, you know? And so technology is advancing so fast that the laws aren't keeping up with it. And televisit is no different. I think right now, they're still trying to figure out what is the optimal way to make televisit work.
Yeah.
Yeah, without, you know, because there are some insurance companies that just won't cover televisit, which I don't agree with either, because, you know, there are circumstances where telehealth is really the only option for that patient.
Yeah.
You know what I mean? And so, but I'll leave with that, you know. And so, you have any closing comments or anything, Alex?
No, that's just my opinion. And personally, if you can go to the doctor, just go to the doctor. You get a better evaluation, better physical, you know, evaluation. So to me, that's the best way.
Right. Because you really can't have the patient, take his own blood pressure or her own blood pressure if they don't. We assume everybody knows how to take a blood pressure,
Yeah.
but that's just not the case. And then now you're talking about listening to their lungs and all that. I just don't know how the primary care doctors make it work, but apparently telehealth is just popping up everywhere.
Yeah.
And so, but anyway, so I hope you guys enjoyed this episode, kind of on our take on telehealth. And like I said, what works for you, what doesn't work for you, just whatever state you're in, just follow the state law and stay healthy and all that. And you will love our next episode because we're going to talk about a very trendy thing right now. Yeah, the semaglutides. They're popping up just like testosterone clinics were popping up. But you got to stay tuned for that one. Once again, this is D-Talk with Dr. Pham and Alex. So thanks for watching, and remember, hit the subscribe button so that we can continue to do what we love as a public service to just the general population. All right, signing off.
We gon' do it like it's priceless. Take it to the moon. Priceless, one day will be soon. Like it's priceless.